This is September, and September I always found is an awesome month for growth. People are back in the routine of things, school has started again, and people start thinking differently about the responsibility, especially the responsibility for their own health. So, September is a great time to put your systems into place and really dial in your training, your huddles, your team meetings. Make sure everything is in place because now is a very opportunistic time to grow. So, what we're going to be talking about today is obviously conversion, and we're going to try to identify different strategies as far as the communication gaps that happen to get people to commit, to commit their own health and dig into their pocket and pay out of their pocket for the care that they need, right? So it's helping them make that decision. And here's one thing. So really when you boil it all down, these are sales techniques. And I really want to qualify that because I know many people have a hard time with the term sales. And it's really, I think this is really important discussion because if you look at sales from a cheesy perspective, typically your mindset is that you're trying to convince something or somebody to purchase something or buy something that you feel that they don't really need. And that's cheesy sales. If you're trying to sell somebody something that you know is not valuable or they don't really need it, that's cheesy. You're trying to convince them. However, on the other hand, if you have something that you know can transform their life, you know that is extremely valuable for whatever problem they have, and you have something to solve that problem, then sales becomes transformative. It becomes something that you do for that person, not to that person, but for that person. So, with that in mind, we're going to talk about strategic ways to communicate that to help people understand, change their mindset, and feel like they're making the decision to jump into what you're delivering. Sid Williams wrote a book called Lasting Purpose. And if you haven't read it, I would suggest reading it because he talked about his ability to become a great chiropractor and persuade people that chiropractic care was the be all and end all for their health and existence and full expression of life. And before he was a chiropractor, he sold pots and pans. And he, in his book, admitted that he was a terrible salesman for pots and pans until finally one day he realized that for him to sell the pots and pans, he had to love the pots and pans. So he used the pots and pans very, very actively in his home. And he found that these pots and pans, they heated up nicely. The meals that he cooked in them were fantastic. They were easy to clean. So he really grew this love for these pots and pans. And as soon as he realized that this product that he was trying to sell, he used himself and he had a love for that, he had incredible success at selling these pots and pans. So he relayed that thinking into chiropractic. So we have this love for what we do. We truly know that this is transformative for everyone that comes into the office, no matter what their condition is, no matter how severe they are. If they have a heart that's beating and their lungs are breathing, they can benefit from chiropractic care. So if we know that, then having these proper strategies in place to share the message with them, that's really, really important. So again, I'm going to share my screen here. So the topic of today's talk obviously is conversion strategies, and this is how to help patients receive transformation. So number one, the first thing that we always do is we highlight the cost of doing nothing. And this was something that I did all the time when I talk to people is that by asking the right questions, we can truly get them to think about what is their life going to look like if they do nothing. And one of my questions that I use all the time, and I've shared this with you guys many times, is that if you just leave this problem, is it going to get better or worse? And then I would just be quiet. And that's one thing I learned to do is just shut my mouth, just be quiet. And that awkward silence is valuable because it helps the patient start to really process the question and think about it. And when they can think about it and answer the question with a very obvious answer, they solidify it in their mind. You're converting their mindset when you be quiet. Ask the question and be quiet. So patients often live with manageable discomfort. Pain is often not the reason or not reason enough for them to do something. So we have to show them what their health will like in 1 to 5 years if they don't take action. And when they feel the future consequences, they'll see this as an urgent thing, not an optional thing. That is so, so vital. Second thing is let patients feel like they're in control. So when you ask the right questions, and allow the person to think about the question and respond, then they're the ones that feel like they're making the decision. You're not pushing them into that decision. You're leading them into making that decision for themselves. So instead of telling patients what to do, you guide them with choices. And so here's a really good technique is that you ask the yes questions. So can you see why I'm so concerned with your condition? Can you see why I'm so concerned with your x-rays? Can you see why I'm so concerned with the results on your nerve scan? And again, just be quiet. I'm going to wait for them to see yes. And then do you agree that this is a problem that will continue to get worse if you don't do anything about it, if you just leave it alone? And I be quiet and I wait for that yes. If you're getting a no, then obviously you need to have that conversation a little deeper, but you just wait for the yes. And then the next question is it a good decision to get this corrected now? And I just be quiet and I wait for the yes. And as soon as you get that, again, you're allowing them to make the decision. You're allowing them to answer the decision. So people commit more easily when they feel it's their decision. Whatever leverage you are using to show that patient after you've done their exam that they have a problem, they have subluxation, it is a neurological problem. So whether that's an x-ray that you're leveraging, whether it's a nerve scan you're leveraging, make sure that in the room that you're having this consultation with, you have normal pictures. Like you should, and they like we had them mounted on the wall. You have normal looking pictures. So this is what normal looks like. This is what yours look like. This is it, this is a normal nerve scan. This is your nerve scan. This is a normal x-ray. This is your x-ray. Whether it's a lateral cervical curve, whether it's a AP view, so you're showing scoliosis, whether it's disc degeneration, so you have a normal looking spine with no disc degeneration, whatever that is, make sure that you can show them normal and compare theirs. And that's when you can say, can you see why I'm so concerned with what I see on your x-rays? Can you see why I'm so concerned with what I see on your nerve scan? It's a really simple strategy. Because if you can show them that, you're going to get a yes. You can see, yes, I see why you're so concerned. Okay. Um, Here's the third point. To bridge this gap, you want to, again, this is another technique in building rapport and building trust. You want to be able to be totally vulnerable and transparent with your patients. So share your struggles, not just your successes. So the key is that patients don't relate to perfection. They want to build a relationship with somebody they can relate to. So if you have the ability, or you can share a story of when perhaps you face health challenges, some level of doubt, or even maybe the struggle of starting a practice. If you have family members who have struggled with health challenges, this is a great thing to add into your doctor's report, into your report of findings, whatever that is, to build trust. And if you can do that, patients will relate to you more, and patients that relate to you more tend to accept your recommendations at a higher level. So when they see your vulnerability, they trust your ability to guide them through their own challenges. Number four, position yourself as a fellow explorer. So you might not always have the answers. So you don't always have to be the all-knowing authority. So you can show patients that you're constantly learning and evolving in your field. The fact that you can share with them that you have a coach, you've hired a coach, you go to seminars to always be improving your techniques and your ability to deliver your care, patients love that. They want to know that they want to know that they're going to the best doctor, the best chiropractor. And if you can show them that you're constantly improving yourself, patients love that. That again builds that level of trust. So invite them on the journey of discovering better health together. And again, this makes the care more approachable. This is huge. Identify the common enemy. And I was really very vocal on the fact that medicine and the medical philosophy and medications were killing people. That thinking was killing people. It's not that doctors and nurses they were caring people, but they were living a philosophy that was totally denying the body's ability to heal when all the interference was removed. And all they wanted to do was put more drugs and give more surgery and more shots and all these things into the body, and that was creating more and more problems. So I would always have ammunition, whether it be studies or articles of where the medical system was failing people or where big pharma was only focused on profits. I would always be sharing that with people. So that just that would basically bring us on the same team, and patients got that. every single person, and I don't care if they even worked in the health profession. I had nurses who were on that side, like who totally agreed with all the stuff that I would talk about. So unite patients by showing them what you stand against, like masking symptoms with pills or the belief that aging was what always means pain. Here's a big thing is that we're in an age now where many of our parents were born in the baby boomer years, and baby boomers are now going into retirement homes and nursing homes. And you see that when you're in that system, you see the problems there. Like there is tremendous problems. The care that those people get is literally in many cases terrible. The food is terrible. So allowing people to understand that what we do as chiropractors creates freedom and independence in health, that is huge. That is absolutely huge. So, and you'll get people on your side and they'll want to refer their family members into you. So when you stand with them against a common enemy, they feel supported and they feel understood. And patients that feel understood, they have a lot of trust. They will often jump into whatever it is you're delivering. Number six, turn objections into motivation. So when patients say, I don't have the time, this is the time to reframe that comment as that's exactly why we need to get this problem corrected now. So time isn't stolen from you later, right? I don't have the money. Well, that's exactly why we need to get this problem corrected now so that you can have the health freedom to create abundance in your life. So instead of avoiding these objections, use them as proof. It's almost like the Aikido. Remember Steven Seagal, the actor, he used the martial art Aikido, and that was using your opponent's aggression and force against him. You would be able to take that aggression and turn it around to use it to your advantage. So instead of avoiding those objections, embrace them and use them as proof that they need care now. Number seven is paint a clear picture of their future self. And this is where we always talk about finding their hot button. I mean, we talk about this with marketing clients is one of the first things that should be discussed on the phone call is not when would you like to book your appointment? It's why did you respond to the ad? How is this affecting your life? What's going on right now? You know, I know you have back pain, but what would your life look like if you didn't have this back pain? So when you start to paint this picture, then you can help the patient see what their life would look like after the problem, like after putting the time in to get this problem corrected. So instead of focusing only on the adjustments and the visits, show them what their life will look like when their body starts functioning at its best. So whether it's playing with their grandkids, enjoying sports, or sleeping soundly, or being off their medications, whatever that is, let them see and feel their future. Any other comments? I want to take a break here just to let you guys chime in if you choose to. All good? Okay. Number 8, elevate identity. So when you elevate their identity, so people don't just want less pain, right? They don't just want less pain. And if you're, again, I have this conversation every single day. If you're just focused on helping people get rid of less pain, you're going to have a mediocre to slow practice. You will, because, and let's consider this, is that every single new patient that comes into your office, if you can assume that they want pain relief, how quickly? They want it now, like today, one visit or less. How much do they want to pay? They want to pay zero, right? So every single patient has that mindset. So our goal is to help them understand that health is a privilege and they have to put some time and energy into it, and get them to think that yes, this chiropractic care is something I want for the rest of my life, not just for me, but for my entire family, and I'm willing to pay out of my pocket because it's that valuable. There's a system that has to be in place to get there. So people don't just want less pain, they want to become the type of person who takes charge of their health. So if we can frame our care as part of who they are becoming, so they're becoming this strong, independent, health-focused, proactive person with full expression of life, full expression of their own creativity. That is appealing to many, many people, and obviously gets them out of that whole medical pain relief mindset. And that's where we have to position ourselves. Number 9, speak to who they already believe they are. So again, this is intentional language. So if you use language like this, so for instance, you're presenting a care plan to a patient. This care plan is for people who want to live their life without limits. This care plan is for somebody who values their health freedom and health independence. If that's you, then this plan is for you. So when you can present it and frame it like that, you immediately capture people's attention to think that, yes, that's the type of person I want to be. If this is something that this chiropractor is presenting to me, if this is a plan that can get me to the person who wants to value my health freedom, my independence, who wants to live my life without limits and is going to help me get there, then that's something that I want to be part of. So when care aligns to their self-image, when care aligns to their self-image, resistance then drops. And the last one is that we tend to oversell our plan. We want to keep it simple and clear. If you've done your pre-framing properly, so in other words, if you've positioned chiropractic properly, if you've shown them what normal looks like and you've shown them what the severe problems look like, and you've related their problems to somewhere on that scale and given them the leverage to say that, hey, this is a problem that will continue to get worse. If you've positioned that properly, then signing on to the plan is really very simple. It doesn't have to be oversold at that point. So if you're having a hard time converting people to plans, it's not the actual plan. It's not the presentation of the plan that the problem is. It's everything leading up to that. So keep the plan as simple and clear as possible. So when you overwhelm patients, you confuse them, and a confused mind cannot make decisions. So you confuse them with details, and it creates the hesitation. So if you can present a plan in its simplest terms possible, this plan is for 12 weeks long, you're coming in 3 times a week, and here's what this will do for you, right? Very simply, here's what this will do for you. We'll see improvement in your cervical curve, we'll see improvement in your nervous system, and that's going to allow your body to start to heal and function the way it's supposed to. It's going to get you back on the golf course. It's going to get you playing with your grandkids. It's going to get you back to work. It's going to get you up in the morning without discomfort and pain. That's what this plan will do for you. So that's what gets the conversion. That's what gets the yes. So if you make it as simple as possible, that's what creates the simplicity for the momentum and the action. Hey, if this video resonates with you, if you found this valuable and you would like to take your practice to the next level, let's say you're struggling a little bit, maybe you're having trouble acquiring new patients, maybe you're having trouble converting new patients, or you're just not collecting enough money and you'd really like to take it to the next level, you'd like to improve it even just a little bit, or you'd like to massively grow your practice, hey, click the link below. Let's set up a call. Let's just talk about where you're at. Let's try to figure out what the bottlenecks are, what the challenges are, and let's put some systems in place to help you to get to the next level, help you educate patients, transform lives, get better results for your patients, and really start to see your practice perform the way that it should be performing. Let's set up a call. Let's figure out exactly what needs to happen to get you to the next level.